welcome to This Explainer. Today, we're diving into the fascinating, and frankly potentially fatal, world of common Indian toxic plants. We're taking crucial, life-saving data straight from clinical management charts and breaking it down so it's highly structured and basically impossible to forget. Whether you're a med student, an outdoor enthusiast, or just curious about how nature messes with human biology, you're in the exact right place. So, let's get right into it.
To keep things moving quickly, we've broken our investigation down into 6 simple parts: general principles, comparing symptoms, hospital management, an antidotes guide, some really clever memory tricks, and a quick summary.
Starting with Part 1, General Principles, and the Golden Rule of Toxicology.
Okay, before you even try to figure out exactly which plant a patient might have eaten, there's a golden rule that applies almost everywhere, and that is aggressive, supportive care above all else. Honestly, this is the absolute cornerstone of treatment. You don't always need some fancy chemical antidote to save a life. Most of the time, you're just trying to buy the body enough time to clear out the toxin naturally.
So what does supportive care actually look like in practice? Well, first off, securing the airway. That's a given. Next, you've got to aggressively correct severe dehydration. A lot of these plants cause violent gastrointestinal purging, so pumping those IV fluids is absolutely critical. You also need continuous ECG monitoring to catch any fatal heart arrhythmias, and you've got to keep those electrolytes perfectly balanced. If you can master those 4 pillars, you've literally won half the battle.
Moving on to Section 2, comparing symptoms, the mind benders versus the heart stoppers.
It's actually amazing how fast you can narrow down the culprit just by contrasting the symptoms. Let's look at the severe mind benders first. We're talking about Dhatura stramonium, which is thorn apple, and Atropa belladonna, the deadly nightshade. And it's super tragic, but children often accidentally eat belladonna because the blackberries actually look sweet. But both of these plants trigger what we call classic anticholinergic syndrome. The presentation is exactly the same for both: extreme delusion, a dangerously high fever, and severe urinary retention.
This brings up a really cool principle in toxicology, the rule of contrast. If you've got an unresponsive patient, just check their eyes. Opium poisoning will constrict the pupils all the way down to tiny pinpoints. That's meiosis. But Dhatura, it does the exact opposite. It blows the pupils wide open into severe dilation, or mydriasis. It's just a simple, visual binary that instantly points you down the correct clinical path.
Here we can quickly compare 3 completely uniquely dangerous plants. First, cannabis, known locally as ganja or bong. It mostly causes psychological distress, think extreme panic and hallucinations, along with physical signs like red eyes and dry mouth. Contrast that with croton tiglium, or Jamalgota. Croton acts as a violently powerful purgative. We're talking burning throat pain, bloody diarrhea, and rapid hypovolemic shock. And then there's Aconite, or Mithabisha. This one is terrifyingly fast. It causes numbness, a sudden paralysis-like weakness, severely low blood pressure, and it can literally cause death within minutes.
Tobacco poisoning from Nicotiana tabacum is super fascinating because it's essentially a game of 2 halves. The timeline here is everything. At first, the body is completely overstimulated. You're going to see excess salivation, vomiting, a rapid heart rate, tremors, and high blood pressure. But as it progresses, there's a dramatic late-stage crash. Everything just drops. The patient plummets into low blood pressure, a very slow heart rate, paralysis, and eventually coma. Knowing that timeline is a total game changer for preventing misdiagnosis.
All right, Part 3, Hospital Management, Correcting the Chaos.
Once we recognize the symptoms, we have to use targeted structural interventions to stop vital systems from failing. Take Dhatura, because it literally freezes up the bladder muscles. Patients need continuous catheterization to relieve that urinary retention, plus active cooling for their fever. Cocaine toxicity also needs aggressive cooling, but here we heavily rely on benzodiazepines to control the dangerous heart rate and muscle spasms. Meanwhile, oleander poisoning really attacks the heart, so that needs multiple doses of activated charcoal, plus a very specific combo of insulin and dextrose to fight off life-threatening hyperkalemia, which is a massive spike in potassium.
Now pause here, because this is a massive clinical warning straight from the charts. If you're managing the severe high blood pressure, racing heart, and chest pain of cocaine poisoning, you must absolutely avoid using beta blockers. Seriously, do not do it. Giving a beta blocker in this specific scenario causes unopposed alpha receptor stimulation, which basically sends the blood pressure skyrocketing to catastrophic levels. Benzodiazepines are your tool here, not beta blockers.
You'll also see gastric lavage pop up a lot as an early intervention, specifically for ingestions of croton, Dhatura, and tobacco. It's exactly what it sounds like. We pass a tube into the stomach to rapidly, literally wash the unabsorbed toxic plant material right out of the patient's system before it can even enter the bloodstream.
Section 4. Antidotes Guide. The chemical reversals.
Knowing which toxins actually have specific chemical reversal agents is an absolute lifesaver. These are your magic bullets. If someone is suffering from that severe central delirium caused by Dhatura or belladonna, the antidote is physostigmine. For oleander poisoning, the dangerous elements are cardiac glycosides, so we bring in digoxin-specific antibody fragments, usually called digibind, to neutralize them. And for opium, which contains morphine and codeine, naloxone is the absolute gold standard antidote to rapidly fix the breathing.
But we have to face reality here. A lot of common toxic plants have zero specific antidotes. There's no chemical reversal for cannabis, croton, cocaine, aconite, or tobacco. For these, we rely 100% on treating the symptoms. That means giving diazepam to calm down cannabis-induced panic, pushing aggressive IV fluids to pull a croton patient out of shock, or using amiodarone for the terrifying heart arrhythmias caused by aconite.
Okay, Section 5. Memory tricks. Making it stick.
In a chaotic emergency, you don't have time to flip through a textbook, right? You need rapid recall. To instantly recognize anticholinergic syndrome from Dhatura or belladonna, just memorize this classic clinical rhyme: dry as a bone, meaning no sweat, dry mouth, urinary retention. Red as a beet, flushed, warm skin. Blind as a bat, those severely dilated pupils. Hot as a hare, a soaring fever. And mad as a hatter, profound delirium and hallucinations. If you see those 5 things, you know exactly what you're dealing with.
For opium poisoning, which causes depressed mental status, a slow heart rate, and hypothermia, just lean on an acronym you already know, CPR. Except here, CPR stands for the classical triad of opioid overdose: coma, pinpoint pupils, and respiratory depression. You see CPR, you administer naloxone. And for both white and yellow oleander, gorgeous plants, but sadly often used for suicide in rural areas, just remember this simple rhythmic phrase: oleander slows the pump, pumps up the potassium. It perfectly describes the 2 lethal effects it induces: severe bradycardia, or slowing of the heart pump, and dangerous hyperkalemia.
Finally, Section 6. Summary. Key takeaways.
Let's quickly connect all these dots back together. First, aggressive supportive care is always your baseline: continuous ECG, airway management, and IV fluids. Second, group the toxins by their contrasting symptoms, like those pinpoint versus dilated pupils. Third, remember those specific interventions, like absolutely no beta blockers for cocaine. Memorize your rare antidotes, like physostigmine and digibind. And finally, use those rhymes and acronyms to keep yourself grounded when the pressure is on.
To wrap up this explainer, I'll leave you with this final thought. We know for a fact that supportive care saves lives. But if a patient is wheeled through the doors right now and they present dry as a bone, hot as a hare, and mad as a hatter, do you remember which 2 plants they likely ingested and that they need an immediate dose of physostigmine? Keep these memory tricks close and you'll always have the answer. Thanks for learning with me today, and I'll see you in the next one.